Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Tom.
And today we're talking about that high hamstring strain or that pain in the butt and what you can do about it. Now, we do have a previous episode on hamstring strains, especially when you continue to get them chronically, and what exercises specifically target different parts of the hamstring. So I would definitely check out that video, but we have a ton more videos, whether it's on mobility, pain, episodes where you can continue to learn like this one. So don't forget to hit that subscribe. And if you have questions along the way, drop them below.
High hamstring strain, which is also known as proximal hamstring tendinopathy. And that word tendinopathy basically just means dysregulated tendon or abnormal tendon. And this tends to be more of an overuse injury, and it can feel really like a pain in the butt because that's exactly where it is. It's right at the top of those hamstrings, kind of where you feel that knobby sit bone that you sit on.
It takes time to get rid of these as well and to overcome this pain and symptoms that you're having.
It's something that is highly re-irritable. So you often see a high rate of re-injury. When people have this, they seem to get better from it, and then it happens again, often because the rehab that they may have done, didn't actually heal the issue. The symptoms just went away, but the underlying issue still remained. It can also be seen as a deceleration injury, which what that means is like if you're somebody who runs a lot, especially if you sprint a lot, it's actually when you're slowing yourself down, because that hamstring, the proximal portion of it, or the portion that attaches right up into your butt, is lengthening as you're slowing your body down. And when we get that eccentric lengthening where we're loading it as that muscle is stretching really quickly, that is a very vulnerable place for a muscle or a tendon to be. Talking about the people who are at risk, it's people with hypermobility, but again, those sprint type athletes, people who have poor warm-ups or cool downs, people who don't have great core hip coordination. So now we want to spend the bulk of this episode on like the phases, kind of the rehab phases that you should be going through. And of course, these will be slightly different depending on the severity of injury. If it's excruciating pain or, to the point where you have a second, third degree tear versus a strain, it's going to be very different rehab protocols. So this is more so a strain with no major tendon or muscle damage. Phase 1, as is the phase for most injuries, is calm it down. How do we calm that thing down? This is the phase where we might need to do some sort of activity modification, find a way to be putting less pressure, less stretch and strain on those hamstring tendons, paying attention to how we're sitting or standing throughout the day even, and then just focusing on some of that basic mobility. So some of the things that you could start to do are just laying on your back, hamstring kicks, feeling how that hamstring feels throughout the range, even sitting with your heels up on a wall, kind of doing a wall hamstring stretch. That can be very relaxing for the legs, but also just start to get that hamstring to lengthen a little bit and let go.
Well, and we know that the first load of tension we put into a tendon is a stretch.
Yeah, it's stretch.
Right? And making sure that we're not going aggressive. This is not where we're trying to gain the most flexibility or anything. It's just starting to put a little load and tension into that hamstring. And then I would say, just like you said, legs up a wall, but using that breath to really calm things down and send different signals into the muscle, is so crucial.
And if you're doing that well, if you're doing that stretch while doing that breathing, you're activating the core. So you're already starting to lay some of the groundwork for that core hip or that core hamstring coordination where, okay, I'm letting my hamstring lengthen, but I'm also engaging and activating throughout my core. Same with hamstring kicks. You don't want to be kicking your leg and holding your breath and bearing down. You want to be kicking and breathing, feeling our ribs expand, feeling our core contract, all that kind of stuff, because you're going to, again, start laying the groundwork for phase 2, 3, and 4.
So if we have a very sedentary job, how can we create things like standing more than sitting? Because that's putting that pressure. I mean, ideally, we're sitting more so on our sit bones, which that's right where that attachment is. So how can we reduce some of that tension just from those compressive overloads of sitting so much throughout the day? And sitting is one of the things that is a risk factor as well for leading into high hamstring strains or the recurrence of high hamstring strain. So just really paying attention to like, how often am I sitting? If I have to sit at a desk, can I ask my boss, hey, can I bring in a ball right now so I'm sitting on something a little squishier? Or can I sit on a Coregeous ball where it can take a little load off of my ischial tubes? You know, so how can we set up our space to look a little different during this phase 1 time to give your body a chance to then mold into phase 2, which is getting into progressive loading. And now this is where we're really starting to do what are called isometric exercises. So that is not moving, but it's starting to create load and tension. And so this can look, as simple as your feet on a wall and starting to just barely lift your hips. So you're in like a 90-90 position and you're doing a wall bridge, but you don't have to go all the way up. You're just starting to press your whole foot into the wall and get used to driving those heels down and feeling what that pressure is. If you hold and take some deep breaths with your tailbone kind of barely coming off the floor there.
Can you put one of your legs up, maybe the affected side, on the wall and just push down into it? So we're at a little more of that stretch and now we're trying to push into it. Or just put your leg up on a chair and then push down into it. And you're going to be activating that hamstring at different angles, which I also think is important, that we start to train and strengthen and put load through that hamstring at different angles.
And going along with all of that too, rather than just using, something external, we can even lay on our stomach and start to get better hip extension. So bringing those legs up and holding at a range, not only are we going to start to work that hamstring and hold, still doing those isometrics, but then we're going to start to build in that intra-abdominal pressure as well. Because rather than just getting into my low back, I want to kind of stabilize it through my trunk a little bit better when I lift my legs and hold. I'm getting glutes, I'm getting outer core, I'm getting inner core, and I'm breathing and holding with that. So it's a great way to start to kind of re-pattern this abdominal and core control for our pelvis as we're going to go through movement, which we can also use by just slowing down basic body weight movements, right? Getting into a hip hinge in an area or range of motion that feels tolerable for you right now, but starting to slow it down, maybe holding in different lengths and saying, can I breathe from my rib cage and make sure that my rib cage and pelvis is kind of moving together as I do these certain movement patterns, and starting to retrain and rebuild how you're moving.
Yeah, and again, in this phase 2, when we're just starting to load and starting to go through movement, being able to be more aware of that core and how it's coordinated with the hips is so important, because as soon as we start to load things up, as soon as we start to go through movements a little bit faster, that's where we might start reverting to our old patterns. So taking your time during this phase 2, really go through, coordinate the core with the hip movement as we're in this still kind of early healing phase before we go into phase 3, which would be more isotonic loading or loading through movement. And this is where we're going to start to progressively increase weights, doing more basic lower body exercises like squats and deadlifts and things like that.
And this is where it becomes really crucial to pay attention to your range of motion, especially if you're a hypermobile person, not just going right into it, but slowing things down. This is so huge. So starting to work on that strength through that length is really important. And this can look as basic as starting with doing some banded kicks to your bottom. So whether you're standing or whether you're laying on your stomach,
like
you
a
have
hamstring curl.
Yeah, you have a band around your heel and you're bringing it into your bottom and then slowly letting it release and working on that long eccentric control. But really, when we're talking about that high hamstring strain, again, that's good for the hamstring muscles, but we need to be working on that hip hinge to start to get used to that tendon reloading in that flexion to extension pattern at that hip. So that's where working on deadlifts, whether it's banded deadlifts, you kind of have a band around you and you're going down into your length, your range of motion that feels comfortable, and nice and slow, and then standing back up, so starting to load even with resistance bands can be a great place to start.
Yeah, and as you start to load and get more comfortable, you're going to progress in the weight, but then you can also progress to doing single leg type activities where it might look like a reverse lunge, because rather than doing a forward lunge where people tend to be a little more quad dominant in a forward lunge, you can do a reverse lunge and then be pulling through that hamstring as you stand back up. You can do a single leg deadlift or more of the Romanian deadlift where it's a straight leg, single leg deadlift. And as again you get comfortable with the movements, how can we start to increase the explosiveness?
I talk about this plan a lot, the full body low impact plan, because for those who want to be doing strength work and those who want to be doing exercise and understand this within their body, that's where I talk through these things so big.
I think the full body low impact plan would be like the perfect encapsulation of phase 3. How do we start to integrate that core hip coordination, start to progressively strengthen and load through the hips. And then phase 4, I would almost say, shift yourself over to the full body high impact or high intensity plan on Gen Health, because that's where it uses more of the HIIT style workout, where you're going to start going into plyometrics, because phase 4 is, okay, plyometrics. How do we start training everything we've worked on in phase 1 through 3 into more of that sport or activity specific exercise that we want to get back to, whether that's running, whether that's jumping, playing basketball, tennis, whatever it may be. And this generally looks like some sort of plyometric training where we're starting with 2-foot, jumping and landing type exercises, and then starting to integrate different planes of motion. So can we do lateral jumps? Can we do rotational jumps? Again, it depends on what your goal is. What are you looking to get back to? And can we train that in a more controlled environment so that once we get back into the exercise or on the street running or on the court, our body's more prepared?
And it really is like, we are going to continue to talk about these phases of treatment for almost every kind of injury. They kind of play a role in trying to focus on the same things, where we're improving our flexibility, our range of motion, but also our control of mobility within that range of motion, especially for hypermobile people. We're building our strength both in a controlled manner and building that mind-body connection through isometrics, and then through more explosive loaded type movements, and then going into those plyometrics and multi-planar directions. Like, we always kind of follow the same pattern when we're thinking about this. And this is why we say you want to honor that entire progression, so that you help to reduce the reoccurrence of it all. And when we're talking about like pain tolerance to this, because it's not necessarily that you're not going to have pain as you're redoing and kind of learning these movement patterns again, but we want to look at, okay, am I experiencing a level that's about 3 out of 10 as I'm moving through this? And it doesn't increase directly after an exercise, and it doesn't increase 24 hours after an exercise, right? You might feel soreness, but hopefully we start to understand the difference between muscle soreness and actually having that pain high into that hamstring, into that glute area.
The phases for healing or rehab of any injury in my shorthand are calm it down, get it mobile, get it strong, coordinate it, and then sport or activity specific. Right? And if you follow those, depending on how you tolerate each stage, you might be in one stage longer than the other, or you might progress to the later stages a little more quickly. You're going to find a successful plan on how to solve the underlying issues, solve the root causes, so that you don't become somebody who has these reoccurring high hamstring strains. Thanks for tuning in for another PT Pearl, all about that high hamstring pain, or the pain in the butt, and how to deal with it. Please comment below. Are you somebody who has dealt with recurring hamstring strains? If so, let us know. Was anything we said helpful? Please hit the notification bell and the subscription button, because we have so many other videos coming out that can help you become better acquainted with your body. And of course, we'll see you next time.